And we are live. Happy New Year, everyone, and welcome to day 5 of Thriving in the Face of Cancer. I'm your host, Chef AJ, and every day for the next 26 days, I will be talking to top doctors and other healthcare professionals, as well as people who have survived cancer, who will be giving you insights on how you too can thrive, even in the face of cancer. Today's guest is a doctor of acupuncture and Oriental medicine who works at the Sutter Roseville Institute for Health and Healing, and he has helped me tremendously on my journey. He was actually one of the first people that helped me. His name is Marc Velez. Please welcome him to the show. It's so nice to see you in real clothes.
Thanks, AJ. Yeah, normally I'm wearing my scrubs, and I used to dress up nice for work. And then the COVID pandemic happened, and I decided it was much more comfortable to wear pajamas uh, to work every day. So
Yeah. Well,
nice to break out the spiffy clothes again.
no, you look great. And
Thank
Mark,
you.
I feel so blessed to have found you. And I'll just tell the audience how we connected. So people that have followed my story thus far know that it took me a year and a half after diagnosis of lung cancer to get an oncologist. And I was not doing very well, meaning emotionally. I still don't have any symptoms, thank God, of what I feel is cancer or lung cancer, but my anxiety was through the roof. And luckily, my primary physician at Sutter, Dr. Jennifer Goldberg, had the wisdom to refer me to an integrative medical doctor named Dr. Jennifer Griffin. Both are lovely doctors, and I can't say enough of good things about both of them. I had never seen an integrative physician before, and I loved the whole experience because one of her things was, well, I'm going to meet you where you are. You know, if you don't want to do this, we're not going to do this. I'm going to support you where you are. And I said, well, I'm just like a nervous wreck right now, just from this diagnosis. And so she ordered several things for me. She ordered something called heart math, which I never quite fully embraced yet, and I might try another session. She ordered some mental health therapy, and she ordered acupuncture. Now, I'm very familiar with acupuncture for aches and pains. That's what I always went to it for. In my 20s, I had a very serious accident. I broke my back. I didn't want to take opiates or muscle relaxers because for me, they have just very bad side effects and addictive potential. So I've always been comfortable with acupuncture. I've always liked it, but I didn't know that there's some benefits to it for people that have cancer, have had cancer treatment, and certainly for anxiety. But what was different about Mark is he didn't just poke the needles and leave the room, like he actually talked to me and just that was like the best part. So, Mark, you're kind of like magical that way.
You're entirely too kind, AJ. Actually, it's such a pleasure to work with you. I really enjoy our conversations, and I mean, it's funny because I think we spend most of our time just connecting and talking. But I think that's kind of that is one of the powers of acupuncture and Chinese medicine that sort of differentiates it from the conventional allopathic model, which is unfortunately becoming increasingly detached and depersonalized with, the physicians typically sitting at a computer terminal. And, now I think we're going to see an increasing movement towards the use of artificial intelligence for clinical decision making and whatnot. The Chinese medicine physician seeks to restore health by being present with the patient, by understanding the patient as an individual and seeing them as a sort of a unique universe unto themselves. We each are very different. And so the one size fits all approach that's sort of characteristic of the evidence-based medicine approach is, I mean, it's very useful clinically, but it doesn't speak to the individual complexities from person to person. So I think this is really like one of the strengths of Chinese medicine, honestly.
Well, it's not just what you do, it's where you do it because I don't love hospitals. I don't know anybody that does, but the place that you work is such a different building and vibe than any other building at Sutter.
Yeah, that's true. I appreciate you taking note of that because the Institute for Health and Healing has been around for probably over 20 years now. And we really seek to model a new sort of medicine practice. I look forward to the day when it's no longer called alternative medicine or integrative medicine. It's just medicine. And so we pull in the best of worlds of our modern conventional allopathic medicine with breakthrough knowledge on functional medicine, and then also honoring the ancient traditions of Ayurveda and Chinese medicine as well. We're really looking to address the whole being, the whole person, and leave no significant dimension of the person unaddressed. And so we have everything from medical evaluations to acupuncture to psychotherapy, heart math, as you mentioned earlier, which is a sort of a method of biofeedback to improve heart rate variability, which has been shown to be associated with better health outcomes when you have sort of a more variable, natural rhythm to your heart. So we really try to bring it all together. But more importantly, we're trying to attend to the human spirit, I believe, as well. And I think that that's something that kind of is shied away in conversations in conventional medicine, especially like oncology. Um, the physicians are, it's a very serious matter. And so the physicians are very focused on trying to give their very best knowledge and treatment plan for the patient. And, so that focus often can take away a little bit from the personal connection, right? There's not a lot of relaxed, easygoing time and getting to know the patient and their lifestyle and their habits and their relationships. And because all of these things are sort of complicating factors when it concerns health, right? But I think and we're just starting to kind of come back around to that in allopathic medicine, is recognizing that, the psychology of an individual is really influential on their health. But for a long time, it was very much sort of that Cartesian mechanistic view of the human body as just a machine. And so we treat it like a machine, and we can pretty much discard the psychology because the psychology is just a phenomenon that arises out of the machine, right? So the Institute for Health and Healing, we we are the mind body department at Sutter Health, and it's really a unique department, um, quite unlike any other department I've ever experienced in Western medicine. And what's really great there is that the acupuncture team is allowed to practice authentically, with the exception of playing with fire and things like that. That's another discussion for another time. But it's not it's not regimented in the sense that, okay, you can only do these points, you can only treat these cases, and you have to do it in this short amount of time, and it's volume driven. And thank God the Institute for Health and Healing has honored the tradition of allowing plenty of time to connect with the patient, evaluate them thoroughly, and treat them, and take your time. So nothing's rushed. So I feel particularly grateful to be working there. It's like, finding the holy grail as an acupuncturist, because most acupuncturists have to, hang a shingle and do it on their own, or they work at a medical clinic, but it tends to be very um, sort of routine and mechanistic and fast paced. So we're very lucky. And I'm lucky that Dr. Griffin referred you to me. She's a great doc, and I'm honored to work with her as well. So,
Yeah,
and it's
I
been,
did ask her to be on the show, and so far she said no. But
oh,
she seems to be a very smart doctor too, because one of the things she also ordered for me, and I forgot to mention, was the gut microbiome testing. And I had cancer researcher Dr. William Lee on the show on Thursday, and he said how important that was for cancer patients. So yeah, and when you go in there as a patient, it's so different than going into like the infusion center, because there's music, there's a waterfall, and they offer you tea right when you come. And the other people that work there, just even like people like Megan and the nurses and the people that take your blood pressure, everybody's so happy. They seem to be a lot less stressed than other departments, and they seem to be very happy to work there.
yeah, I think that's because the IHH culture kind of emphasizes that, right? That we're very sort of a familial group, and the idea is that we should be happy doing the work that we're doing, right? I mean, it's a joy to be of service to others and to help reduce suffering in the world. And so I think that we often remind ourselves of that. We stay in touch with that higher purpose of our being there. And so, it's a medical workplace, so it can be very intense and fast-paced and laborious, but there's a lot of good cheer, and we feel really fulfilled doing this work because we know that we're really making a difference in the world.
Yeah, I love it. And I also what I love about it is even though I never thought my insurance was very good, it's accepted. And I've always had to pay just like, $100 when I just went for acupuncture somewhere else. So it's working for me.
Yeah, I hope that in the future, insurers will cover a greater breadth of approaches, so that integrative medicine, acupuncture, and massage are included.
Oh
Uh,
my gosh, that would be amazing because those are the things that really heal you from the inside out. Maybe there might be people unfamiliar with acupuncture or what kind of training is involved in getting it or who it helps or who it's for. Because I've told a few people about how great you are and oh, I'm afraid of needles. And, I'm afraid of needles too when they're taking my blood, but these needles, you don't even feel them. They're so fine.
I mean, I'd like to jump on that bandwagon and say, oh, you don't feel a thing. But as you know, that's not entirely true. There is sensation involved, and it's not on the end of the spectrum that's like a tickle or a real pleasant sensation. But it's not horribly painful. It's very brief pinprick, if anything. And each time a needle goes in, you feel a little bit more brain chemistry getting released. And I mean, I don't know about you, but I always feel really, really calm and elated and at peace after receiving acupuncture. So, but yeah, just to speak a little to acupuncture as it's practiced in the United States and especially here in California, where we both reside. So, acupuncturists typically will attend a full-time postgraduate program for about 4 years, and it's really intense. And we cover not only Chinese medicine but also conventional allopathic medicine as well. So we have a very broad perspective of health and wellness. And so to sit for the state licensing exam, most states require that you've gotten over 3,200 hours of education that involves both classroom and clinical time. And then many of us go on to pursue postgraduate degrees like doctorates. And so I recently received my doctorate from the Five Branches University in San Jose. And that was another 2-year program, also very intense. I don't know how I pulled it off working and being a dad and all that. But so acupuncturists are licensed. We are insured with malpractice insurance. A lot of people kind of think we're just like glorified massage therapists, but really we've taken a lot of time to educate ourselves and also to cultivate ourselves, because the way Chinese medicine is practiced, it's not by interpreting lab results or looking at radiology imagery or anything like that. We're looking at really subtle things like the color of the complexion or what we feel in the pulse or how the tongue appears when the patient sticks their tongue out. And so oftentimes we need to really be quiet internally to be able to perceive these really subtle things. Like, for example, if I'm having a conversation with someone and I bring up a particular subject and all of a sudden you see a change of color in their face, and it's just a flash for a moment. But that's clinically meaningful in Chinese medicine terms. And in order to be able to pick up on these things, you got to be kind of present and calm. So most acupuncturists, I mean, it's kind of a lifestyle. It takes our whole being to engage in this medicine. It's not a fair weathered practice.
Yeah. When you say about sensations, for me, I feel like it's like the deepest sleep. And I don't really have sleeping problems, but something just happens to my nervous system once you put the needles in that I go to sleep the whole time, but it's a deep restorative sleep.
Yeah, I think what you're experiencing is the autonomic nervous system is shifting over into parasympathetic dominance. And I think most of us in modern life kind of live in a low level or high level in some cases of fight or flight sympathetic activation of the autonomic nervous system. And so that comes at the expense of the sort of self-regulatory background input of the parasympathetic nervous system, which is responsible for maintaining the righteous function of our internal organs, maintaining our immune system, and our health overall. And so what we've seen over the years, and this is known through Chinese medicine long history of Chinese medicine, but also confirmed in Western medicine as well that, chronic prolonged stress on the body makes it start to fail. The immune system gets compromised, the digestive system gets compromised. So when we get acupuncture, for a lot of folks, it's the first time in their day, or sometimes in many years, that they are forced to do nothing. Usually you have needles in your hands and feet and legs and arms. And so, you can't be scrolling your phone or reading a magazine while you're receiving acupuncture. So you're literally pinned to the table for half an hour to an hour. And so a lot of people, sometimes they get up off the table and they say, oh my gosh, I was so tired after that. And, they think that the acupuncture did something, bad to them. But actually, usually what that is that these people are actually extremely exhausted, and they've just been kind of running on fumes in this sort of hyper vigilant state that they're overriding their fatigue and exhaustion. And when we finally get that parasympathetic dominance in place and get them to relax, the body says, oh my gosh, I'm tired. And it's finally letting them know I'm exhausted. I need more rest. So I think it can be pretty insightful. And I think that that's one of the biggest gifts that acupuncture and Chinese medicine offers to the patient is a reflection, a view of themselves internally, right? Like being able to see yourself more clearly, awareness, self-awareness into the body. Because I think, especially these days, we're just very distracted by
You know, I
everything.
think I think about my sorry if I interrupted, but I think about Michael Jackson and how he couldn't sleep, and I wonder if he ever tried acupuncture because if you did what you did before, people that have trouble relaxing or sleeping before bed, I think people would sleep through the night. And I'm so thankful that you ordered it, every week for me, at least at the beginning, and now it's every other week because it's impossible to get an appointment with you. But other than other than that, it's amazing, and I wish more people could be exposed to it and it could be more affordable for more people because I think most people that would do it, just like massage or Reiki, they would end up really, really liking it when they see what it does for things like anxiety and also pain relief. Like whatever I had, like, you were able, it's so funny because I couldn't get in to see the orthopedic doctor when I had my impinged shoulder. And you just like, oh, I think that's what you have. And it's exactly what I had. But in the meantime, while I was waiting for my steroid shot and physical therapy, you were able to make the pain go away. So that's amazing service right there when you can make people's pain go away without having to take, prescription medicine.
Yeah, honestly, I think that the system's turned on its head upside down a little bit. I think acupuncture should be one of the first line interventions, actually, because it's minimally invasive, and we can often address myriad complaints before they turn into a disease state. And I think, and not only that, but the depth of evaluation that we perform can be very clinically useful for the specialist provider. Say, for example, the shoulder. I mean, I'm doing an orthopedic exam on you, that that gives them like a head start, right? And sometimes there are other things that may be complicating the situation that don't come up in the routine conversation when the doc is just looking at your shoulder and just examining an MRI of the shoulder, not recognizing that there may be other things going on in the body that may be affecting the connective tissue or the bones or your posture, right? And so really, we want to address all systems for optimal health. And this is really, I mean, people talk about acupuncture, but acupuncture is really just the tip of an iceberg, right? And sharp, pointy tip, if you will. The rest of what's beneath the surface, though, is Chinese medicine. And I mean, Chinese medicine is, depending on who you talk to, is between 2,500 and 3,000 years old. And it's evolved like through thousands and thousands of years of continual observation and experimentation and documentation. These ideas were tested and challenged and refined and tested again throughout the centuries. And what we have now is this very refined and nuanced system of medicine that's, I think, perhaps the best suited and accessible system of maintaining health and preventing and correcting disease. Now, that's not to knock conventional medicine. Conventional medicine is incredibly powerful for life-threatening situations. It's the nuclear option. But what gets neglected is everything leading up to that point. If a patient comes in and they've got minor complaints of, oh, I got a pain in my elbow, but then it moves to my shoulder, then it moves to my knee, and then I get headaches, I'm having trouble sleeping at night. And the doctor's kind of like, well, you're getting old. It's arthritis. And they just leave it at that. But you come to a Chinese medicine practitioner and they're going to evaluate you thoroughly. And maybe it is that there's some sort of imbalance that needs to be addressed. And when that imbalance is corrected, everything else falls into place and is corrected on its own. So allopathic medicine tends to be very disease focused. And, Chinese medicine, on the other hand, is health focused. Rather than literally going to war against a disease, Chinese medicine seeks to work with the person, the whole person, recognizing that disease is the body trying to get our attention. And so these sort of preclinical symptoms are indicators of early imbalances. And so when we correct them, they don't build momentum and develop into disease.
Yeah, that's wonderful. I actually, it's funny when I had my show about coming out, I had lung cancer. I heard from a few physicians that were saying that they realized they were kind of unhappy with what they were doing in medicine, and a few of them were saying they actually were studying to be acupuncturists. Isn't that interesting? Because that was something they wanted to do. So that's pretty cool. So yesterday, I don't know if you saw the show, but Dr. Dawn Musalem, who is a cancer survivor as well as an oncologist, was talking about how acupuncture can often help with patients going through cancer or some of the side effects from chemo. And we have actually a question from a live viewer named LJ. And LJ wants to know if acupuncture can help peripheral neuropathy caused by chemotherapy. So maybe you can answer that question as well as what else acupuncture could do for somebody going through a cancer journey.
Yeah, great question. And absolutely. So acupuncture, I think, stands as one of the more promising interventions for treating chemotherapy-induced peripheral neuropathy. There's really no consensus intervention for the treatment of that condition in oncology. Usually something like gabapentin will be prescribed. The problem is that there's a derangement of the internal structures of the neurons themselves as they've been insulted by the toxicity of the chemotherapy. And so whereas the gabapentin can help to allay the symptoms and reduce how you feel, acupuncture is stimulating the nervous system directly. And one good thing about the peripheral nervous system is that it has the potential to regrow and reconnect, right, and regulate itself over time. But what needs to happen is there needs to be some sort of an input to make that happen. And so regular acupuncture treatment can stimulate the nervous system in a way that will help those neurons to start reconnecting and the internal structures to heal and regenerate so that the neuropathy is minimized. For a lot of folks, unfortunately, it's going to be a lifelong condition. There's always going to be a little bit of tingling or some numbness, but if we can reduce it, 50, 60, 70%, I think most people would be really happy with that. And in some cases, it's resolved entirely. One of the challenges, though, that I've experienced clinically with that condition is that it's usually years out before a patient gets referred for this persistent neuropathy. Their oncologist finally says, well, we tried the gabapentin, it's still holding on. It's been a couple of years. Let's let the acupuncturist have a stab at it, unintended. And it's much harder to treat at that point because the entire nervous system and the brain is rewired for those pain signals, right? And so it's become a harder wired connection. The best time to get treatment is during chemotherapy and immediately after chemotherapy. And this, according to several research studies, this has been shown to have a better shot at reducing the neuropathy. So yeah, I would encourage anybody who has chemotherapy-induced peripheral neuropathy to give acupuncture a try,
How often should a person go? Just for a particular problem or just maintenance in general? I
That's a
mean,
good
like,
question. I mean,
because is every day
everybody's
too
got
much? Is every day too much? I mean,
I
I would go every day. Yeah.
mean, I would too. I don't think every day is too much. I mean, but every day for a year, that might be a little overkill. I don't think that that's necessary, but I think everybody needs something a little bit differently. And so some people are fine getting acupuncture once a week. Some people can get it, once a month and maintain, low pain levels and feel great. If we're working on something that's really persistent and uh, very strongly present, like a high pain level or a real severe neuropathy, we're definitely going to want to try to get in 2 or 3 times a week, at least for, 4 to 6 weeks, right? And it can be a pretty intense treatment schedule. That's going to really give you the best results. And when you look at the research literature, especially the research coming out of China, the protocols tend to be at least twice weekly treatment. And so here in the States, though, because of scheduling and insurance and, our job, life, and everything else, we're often only able to do it, once a week or every other week or less. Some people are very sporadic with their treatment, and that makes it challenging to make any meaningful progress. Though that's not to say that it's not helping in some way.
Yeah. It's too bad we can't do it to ourselves. I mean, we probably couldn't reach a lot of the points, but maybe hey, maybe you could do that self acupuncture. And I always thought it would be cool if how like I get these specialized massages. They're like these very focused medical massages because I'm trying to avoid a procedure with my back that I broke. But the guy comes to me and I bought a massage table. It'd be kind of cool, like if you had like have needles will travel, so to speak.
I'll put that on my business card. That's a great slogan. I love it.
Yeah, absolutely. So, and just before I get to some of the other viewer questions, and thank you guys so much for your questions, is there ever a contraindication to acupuncture? Are there some people that, for whatever reason, shouldn't have it?
Well, I think that there are very few that would apply to. And when patients are pregnant, you want to just be a little bit more cautious. Um, there's not really much risk. I mean, the vast majority of research studies and meta-analysis performed on these studies has shown that acupuncture is exceedingly safe with minimal side effects and very few adverse events. Every so often you hear about somebody getting a pneumothorax, their lung getting punctured by a
Not
needle.
one of those, but the needle was a lot bigger.
Right. And or a needle breaking off, right? God forbid. That's never happened. I've been in practice, 15 plus years, and I've never had anything like that. Knock on wood. I don't want to jinx it by saying that. But what you see though is that those cases where those things are happening, either the practitioner was maybe not so skilled or a little extreme in their technique, right? And a lot of those cases come from overseas where people are unlicensed and they're doing these procedures out of their garage, maybe. Or unfortunately, we see there's a movement towards physical therapists performing acupuncture in the sports medicine setting. And while it can be very effective, some of the things that they're doing may lead to those sort of outcomes because they're having the patient move and actively flex with the needle embedded in the muscle. And so, but with your routine Chinese medicine or Japanese acupuncture, uh, exceedingly rare that that's going to happen. And as far as contraindications are concerned, there really are none. I mean, even if you've got like lymphedema from, following cancer, it's still safe. The risk of infection is very, very minuscule. The needles are sterile, right? And we clean the skin with alcohol before we insert the needle. So the chance, and they're solid. It's not like a hypodermic syringe where there's a bore that could carry some contaminant into the body. These are solid needles and they're like hair thin. So there's really nothing to get in there, right? So we don't see infections happening very often in acupuncture.
The reason I know it's not just the placebo effect for acupuncture is I had a dog named Ginger and she had knee surgery and she would go for acupuncture and she would go in limping and she would come out not limping. And there's no way that it could be, with a dog. I don't think with a dog. Hopefully,
Absolutely. Yeah,
yeah.
there's no expectation effect in animals, right? And if you speak to veterinary acupuncturists, they will tell you the most miraculous stories. And I, my family and I experienced one of these miracles ourselves with our aging kitty. She was really old and had really severe arthritis. She was writhing in pain. And we went to the acupuncturist, and uh, after the session, she slept for several hours and she wasn't in so much pain. And her elbow would click when she would walk. That went away over time. And it was almost as if it rolled back the years on her life. And one day came home, and this was a real like sedate cat, never jumped on anything, and we saw her on the top level of the cat structure, and we were shocked. I thought my wife had put the cat up there. She climbed up there herself, and we were all just flabbergasted by this. So it this speaks to a larger thing, because a lot of people want to say that acupuncture is theatrical placebo, and we cannot discount the power of the human mind in its effect on healing. But given the veterinary acupuncture results, I think it's safe to say that perhaps it is our expectations that are maybe blocking the efficacy of acupuncture. And in my experience, the sort of background nervous system tone is the biggest indicator whether somebody's going to get a good effect from acupuncture or not. So I've worked a lot with veterans from the service, and the ones who have the most severe PTSD and pain, very difficult to treat because their nervous system is just humming in this fixed state of hypervigilance from the trauma of war. And it's almost like the background noise when you're driving down the freeway. You got to crank the radio up real loud to be able to hear your music. Their nervous system is like that loud background freeway sound. And the whisper of acupuncture is difficult to be discerned through that sort of background noise. But when we start calming their nervous system down over time, then their pain starts resolving. You can't just like treat the pain directly. You got to go sort of obliquely in some of these cases and help them to relax their nervous system, to be calm, to be at ease. Then we can start addressing some of the other stuff like the chronic back pain or the knee pain.
Yeah, I love it does. It's so calming. So Lena, who's watching live, said, would it be helpful for neuropathy that is not induced by chemotherapy?
Yeah, so I find that idiopathic neuropathy is probably one of the better things to treat, right? Because there's definitely still hope that there's no severe neural derangement that's taking place. And so I find that I get pretty good results for idiopathic neuropathy. And then there's diabetic neuropathy, which for all intents and purposes is kind of similar in the sense of the derangement that occurs to the neurons themselves. So it can be challenging to treat as well, but I've definitely had lots of cases that have improved pretty dramatically.
That's great. I want to read a comment to you from Tracy, who's watching live on Instagram, and she says, my husband and I are okay, I gotta put glasses on and stop being our acupuncturist, and we treated several patients going through cancer treatments. It certainly helps manage the symptoms of chemo. And in China, it's common to get daily treatments depending on what is being treated. Acupuncture works best with several consecutive treatments. Thanks for watching, Tracy. Yeah,
Absolutely. Yeah. Thank you, Tracy, for putting that out there. Let's talk a little bit more about that, if I may.
sure.
So just as far as the various things that can be supportive of the cancer journey with acupuncture and Chinese medicine. So a lot of studies have indicated that it is helpful for reducing cancer-related pain. So for example, when you have metastases to the hip bones or something like that, or to the spine, and you've got just this constant intractable pain, acupuncture can help to manage that pain a little bit better. There's also the chemotherapy-related fatigue and nausea that is also really helped tremendously by acupuncture. And, I've treated a lot of these cases over my years at Sutter, and across the board, the nausea gets better, the fatigue improves, and also dry mouth is one of the side effects that often happens that can be treated with acupuncture. And the neutropenia and leukopenia that can result from chemotherapy and radiation. So when your white blood cell count starts to crash, acupuncture's been shown, especially electroacupuncture, has been shown pretty reliably to increase those white blood cell counts. So there's many supportive things that we can do for somebody who's going through the cancer journey. And I think anxiety and depression that often goes along with that is also well addressed with the acupuncture. But I think, like, perhaps most importantly, what it offers is a supportive space of healing through rest and deep listening, reflecting, and stillness. There's a human connection that I feel that is characteristic of the acupuncture practice. And I think, AJ, you've kind of expressed to me how sometimes you feel like the doctors are they're just kind of dry and not really very personable. You know, they may be nice enough and everything, but they're not connecting with you as a human being. And I think as something that's totally integral to the practice of acupuncture is connecting with the patient on a heart level. So,
Because you don't and nobody at the Institute of Holistic of Health and Healing treats me like a cancer patient. I just happen to be a person that happens to have cancer, and that's a whole different experience than when I go to other doctors where that's all I feel like I'm being addressed about.
right, absolutely. Yeah. Because first and foremost, we got to take assessment of what's right with you, right? And I can tell you that there's more right with you than there is wrong with you.
Well, you always made me feel better that way, saying, like, you don't look, I mean, just even hearing, like, you don't look like the typical cancer patient. You don't look sick. And, I remember the chaplain saying the same thing. I just saw 27 patients that seem to be a lot worse. I mean, it give me hope. That's the thing. It should be the Institute of Holistic Healing and Hope, Triple H, the Triple H Center.
I like it. Maybe the next iteration will include that. I really love that. That's
Yeah.
yeah,
Well,
I
God,
think hope is so important, to be maintained. And I think the conventional model tends to easily promote a sense of hopelessness. Everything is viewed as a disaster, and you're given a life sentence. And I think the Chinese medicine and acupuncture approach is the opposite of that, that we're looking to preserve life, right? We're looking to give you the best quality of life. And even though a patient may be terminally ill, there's still the possibility for healing, in the sense that healing is more than just the absence of disease, as is health.
yeah. So I've got, believe it
There's
or
a
not,
healing
I
of the
did.
spirit, right? That needs to be attended to. And I think, unfortunately, in our day and age, that the human spirit is suffering right now across the board. And so any opportunity that we have to attend to the human spirit with a little bit of love and attention, I think that's some of the best medicine in the world.
Absolutely. And laughter, by the way. And that's why I tell you jokes every time. Okay.
I always love your jokes. It's our sessions are great.
Yeah, and you actually laugh. Can you imagine, like, if I tried to tell some of the oncologists those jokes, it'd be like, you know. Anyway,
Laughter is good medicine, right? And part of it is that it puts your body at ease for a moment. It shifts you out of that state of fear and hypervigilance. There's a there's some foundational things that we talk about in Chinese medicine from the ancient writings of the Yellow Emperor Huang Di, and conversations that he had with his court physician Chibo. I mean, this book goes back to like 300 BC, and one of the lines out of there is that when the heart is calm, that the qi will harmonize, the vital energy of the body and the function of the body will self-regulate when we are at ease and in a state of tranquility. And so laughter connects us in a way that makes us feel at ease. We put down our guard and we connect from the heart. So in Chinese medicine, we say that different emotions and affects are connected to the various organs, right? Like anger is related to the liver and fear to the kidneys. Well, laughter is the sound of the heart. And so there you have it. When we laugh, we're nourishing the heart. And when the heart is at ease, then the systems of the body have a better chance to self-regulate again.
Yeah, well, that's why I'm going with humor because that's my favorite thing in the whole world is to laugh and make other people laugh. And going to you, it's more like I feel like I'm seeing like some kind of shaman, and I'm wondering if people can go to you. I mean, obviously, if they live or are willing to travel to Roseville, they could probably make an appointment. I don't know if it requires referrals, but don't you do some kind of like coaching or consulting for people that don't live near you?
Yeah, I do. I mean, I do remote sessions, herbal consults and health coaching and things of that nature. I mean, there's a lot that we can do that is beyond just acupuncture. I mean, obviously acupuncture, I'd have to be physically present until we pioneer the autopuncture that you were referring to earlier, where you can needle yourself. But you know, as I was mentioning earlier, acupuncture is just the tip of the iceberg. I mean, there's diet, there's lifestyle, there's breathing, meditation, there's cultivating right thinking. I mean, there's all kinds of things that we can do. There's herbal medicine, supplements. It's all within the purview of Chinese medicine practice. And so for a lot of folks, they'll reach out to me because they've got some sort of autoimmune condition that they've been recently diagnosed with. And I'll set up a session where we can talk and totally evaluate their situation. And I can give them a game plan for how to stack the cards in their favor over time. And, you know, maybe at some point they can come and see me in person and I can take their pulse and we can have an acupuncture treatment. But there's just so much that we can do without ever having to actually see a person face to face in person. So yeah, people are totally welcome to reach out to me. You know, my email address is Dr. Marc, DRMARC, at acupeople.us. I'm sure you'll include that in your live stream notes today. And yeah, if anybody's interested in setting up a time to talk, I'd be happy to entertain that. And I also do treat people on the side. I have a very small group of people that I work with outside of Sutter, mainly because my work there keeps me so busy and I'm a family man. So I try to keep the rest of my free time devoted to family life. So I'm not looking to set up a side hustle necessarily, but anybody who's suffering and wants to feel better, I'm happy,
Yeah.
so happy to work with them.
And apparently playing a game called Settlers of Catan, which I had to look up because I had never heard of it.
Oh yeah. When did that come up?
Listen, I listen to you. You
Yeah, that's
just,
one of my favorite games.
yeah, maybe we could play it sometime. It sounds intriguing. Mark, we have like 10 questions from live
Oh
viewers.
gosh.
I
Okay.
didn't know this would be such a interesting topic to them, so I'm so happy. So let's start getting through them. So the first one is from Mar. Do you see patients with seizures? My daughter was diagnosed with grand mal seizures and was wondering if it would help my daughter.
Yes, absolutely. I've treated many patients with seizure conditions. The only contraindication is that you generally do not want to do electroacupuncture, which is where you connect a device. It's kind of like a TENS unit where you're connecting to the needles and passing a gentle electrical current through the body, only because of the impulsing that it does, right? It'll send out an impulse every few seconds or whatever, you know, several times a second actually, and that can trigger a seizure potentially. But outside of that, manual acupuncture, there's no contraindication at all. Obviously, if somebody's having frequent seizures, you probably want to stay in attendance with that patient during treatment. So if they start to have a seizure, you can take needles out. But it's been my experience that seizure activity typically reduces and quality of life overall improves because it's usually not just seizures. There's a lot of other stuff that goes along with that, like headaches or digestive disorders, things like that. And all of those start to clear up with acupuncture treatment. And so, you know, they have a much higher quality of life overall. So yeah, definitely worth a shot.
Thank you. And the next question's from Infinite Love and Gratitude. That's a wonderful name. Can acupuncture help with neurological complications from long COVID and mast cell activation syndrome?
Yeah, so mast cell activation syndrome is a challenging condition to treat. But honestly, I think that it speaks to some of the conditions that were referred to in the ancient manuscripts of Chinese medicine. You know, sometimes you get these weird combination of symptoms. And so herbal medicine often works really well for that. And acupuncture can help to regulate the immune system as well. So it's definitely worth a shot. And neurological conditions secondary to COVID infection can be very well treated with acupuncture. In fact, I've had a couple of long COVID patients, and they've all made leaps and bounds of improvement. I had one patient, very interesting case. She had a sensation of somebody twisting her ear all the time, constantly. And after 2 or 3 sessions of acupuncture, that sensation completely disappeared. And she had, profound post-viral fatigue, and it was very difficult for her to function. She had brain fog. All of that improved. It took a little while, and we also pulled in herbs and supplements and dietary changes and things like that. But after working together for close to a year, I mean, she was vastly improved, and her sense of smell and taste returned as well.
That's great. How does acupuncture support the immune system? I'm not quite clear how it does that.
Yeah, well, the exact mechanism is still a little bit unclear, but we can say that there's local inflammatory responses first of all, and so when we're working with like an injury, for example, we're going to create a little bit of a localized inflammation, and that's going to kind of garner the body's natural healing resources to that area. It's going to increase blood supply. So, blood is life in the body, right? And so the more blood we can bring to an area, the faster the healing is going to take place. But overall, what we're doing is we're stimulating the nervous system, right? And we may be stimulating it peripherally in the hands and feet, but all of those signals are being carried to the brain in turn. And then the brain is responding accordingly. And that can trigger changes downline into the pituitary gland, which is, of course, the master hormonal regulator of the body. And also with that vagal tone in the background, that can also really affect the immune system. And so, again, the exact mechanisms are still being kind of teased out. Acupuncture is a difficult field to research. It's a lot of times there's all these different effects that are happening, and you can at one point measure something that's happening in the body, but you go to another point and it's doing something completely different. So, but we know from experience over the years that acupuncture can definitely bring benefit to regulating the immune system, especially in cases of like autoimmune disease. It just helps to kind of normalize the body's function. I mean, we're basically hardwired for health, right? I mean, you cut your hand, you don't bleed out unless you've got some sort of a bleeding disorder. The cut heals, right? And a year later, you don't even know where it was. You break a bone, it knits back together. You catch a cold, you recover. So all of those are indicators that the body is hardwired for health and self-repair and regulation. But something will block that process from taking place. And maybe it's inflammation from a workplace where you're exposed to a lot of environmental toxins, or maybe it's a poor diet, and maybe they should start reading Chef AJ's book and getting some great ideas on how to change their diet and follow a clean way of life. Other times they're really stressed out, or they're not sleeping enough. All of these things can affect the immune system. They can affect the body. So we're looking
Thank,
at all that stuff in Chinese medicine.
thank you. So here's a question from Amy on Instagram, and she would like to know if you recommend acupuncture for someone who just underwent knee replacement surgery.
Absolutely. I see no reason to not get acupuncture. So it's going to help to accelerate the healing most likely, and it can help to reduce the pain. Acupuncture sometimes is magic for pain. I love working with acute pain. So for example, if somebody's right knee is hurting, I may stick some pins in the left elbow and then have them move their knee around. And all of a sudden they get a look on their face and they say, "That's weird." And "that's weird" is my favorite thing to hear in the clinic, because I know I got them at that point. They really experienced something unique that's kind of boggling their mind. They're like, "Hey, the pain went away all of a sudden. Is that supposed to happen?" The answer is yes.
Wow. I love it. And then somebody asked about regular knee surgery. So the answer is yes to that as well. Okay. Deborah would like to know, how do we find a good acupuncturist? Is there a certain certification we should look for or a good website to use?
Yeah, great question. To the best of my knowledge, there's no centralized website that lists all the acupuncturists. It depends on where you live. So in the United States, there is the NCCAOM, which is the National Accreditation Organization for Oriental Medicine Practitioners. And they often will have a listing that you can go and search for a practitioner. What you basically want to look for is somebody who is licensed in the state that they practice. That's an absolute must. And then you want to find somebody who's experienced, and basic things, right? But I think most importantly, you want to go and connect with that person. You want to meet them in person and see how you vibe, because everybody's a little different. And so, there are people who are not a good fit for me when we come together and I evaluate them. And sometimes I'll refer them to another practitioner because I just feel energetically or personality wise, we're not meshing, right? Because it's really important to be able to have that connection. You want to have somebody who's a clear communicator, somebody who really listens and addresses all of your complaints and doesn't just blow you off, or they think they know it all. You probably want to avoid people who present with a lot of smoke and mirrors, or mystery about their practice. They should be upfront and honest and open with their practice, and you should feel heard and well attended to. And I think actually that's probably the best way to gauge it, whether an acupuncturist is going to work for you or not. So, but generally acupuncturists will put a listing on Google, and so you can Google it. And as far as insurance is concerned, insurance, whether an acupuncturist takes insurance or not, can be kind of spotty. A lot of acupuncturists, to save costs, actually don't want to deal with insurance because it's actually really costly to chase down reimbursement from the insurance companies. And so a lot of folks are just cash based. You can also do community style acupuncture. And so for that, you can go to, I believe it's POCA.org, POCA.org. They're the People's Organization of Community Acupuncture, and they have a listing of all the community acupuncture clinics in the United States. And what that refers to is a group setting acupuncture clinic. There's like recliners in a room. Everybody keeps to themselves, and it's very quiet. And the advantage of that is that it's sliding scale cash pay, often for less than what you'd pay for a copay. So it's very affordable, very accessible to everyday people, and their schedules are often way more accessible than private insurance pay acupuncturists.
Hmm. Is Pokemon your favorite cartoon?
It's my son's. It's one of my sons.
That's funny.
Yeah. And
Okay,
I am the Pokemon. Yeah.
exactly. Thank you. TS says, do acupuncturists or holistic healers need a license to practice? And how is a legitimate person to be found? So that's sort of similar.
Yeah, absolutely. In the United States, you basically need to have a license to practice in most of the states. There may be a couple states that's still unregulated, but all the major states, New York, Florida, Texas, California, Oregon, Washington, I guess that's my idea of major states. My apologies to the other states out there, folks living there who I didn't include, but most everybody requires, that you've graduated from an accredited post-secondary graduate school, and then you've either received state licensure or you've achieved the um, Diplomat of Oriental Medicine or Acupuncture from the NCCAOM. And so, yeah, those are kind of the things you want to look for. And if somebody's kind of doing a shade tree acupuncture clinic, you want to steer the other direction.
Great. Thank you. Denise says, can acupuncture help with tinnitus or tinnitus?
Yes, it can. And, unfortunately, tinnitus is one of the more challenging conditions to treat because it has many different underlying causes. And so, depending on what's going on there, if we can treat the underlying cause, then oftentimes it will be reduced or resolve. But other cases, the damage is pretty much done and in place. And it's honestly, it's one of the more challenging conditions. But there's always room, to try, and you won't know unless you give it a trial. And speaking of which, you should commit yourself to at least 6 to 10 treatments. I find the vast majority of folks, it takes about somewhere between the fourth and sixth treatment is when most folks start to notice a meaningful change. Some folks, it's after the first visit. Some folks, it's 20 visits, but it's like the belly of the bell curve is right around 4 to 6 treatments. So So don't go just once and then say, oh, it didn't do anything for me, so I stopped going. Keep it up. You got to get
Yeah.
repeated.
It's cumulative.
It is cumulative.
Yeah,
Absolutely.
absolutely.
It's like we're injecting a little signal, a small signal in a very complex system. And that small signal takes time. It's like the butterfly effect in the body. So a little
Absolutely.
stimulus can lead to a big change down the way. And that can take time sometimes.
Susanna would like to know if you could recommend a good book on basic understanding of acupuncture.
Yeah, well, sort of the seminal text for that is it's called The Web That Has No Weaver by Ted Kapchuk. And it's widely available, used and new on Amazon, or many used bookshops will have that book as well. That's sort of the required reading to get in your first year in acupuncture school. You got to cover that book. I find that's probably the one that gives one of the best overviews. Henry C. Liu, last name spelled Lu, has a lot of books on Chinese medicine as well. His books are pretty well written, and he makes it very accessible to the everyday person. In fact, there's one, I've got so many books on my shelf, I'd be hard pressed to try and find it right now. But it's called Chinese Natural Cures. And that's a great book because he goes into all the qualities of food and herbs and how your diet can affect your health as well, which is, I know, something that's very near and dear to your own heart, Chef AJ. And so that's a good book. His stuff is readily available out there as well, easy to read.
Right. Can you acupuncture yourself?
Any point that I can needle, I will. And in fact, I practice on myself, fairly often because it helps me to understand the sensation that I'm looking for or the depth of insertion. And I mean, honestly, I kind of feel like if I'm going to do that to somebody else, I should be willing to do it on myself as well. So yeah, I basically practice all the things that I preach and perform on my patients. So I have a pretty extensive cabinet full of herbs and supplements that I take every day. I practice Qigong, which is sort of like a energy exercise. It's a therapeutic form of exercise that's non-strenuous. I practice Tai Chi and the martial arts. I practice meditation as well. And so a practitioner can really only lead somebody as far down the path as they've explored themselves, right? So with that, I also kind of feel like that's kind of humbling, right? And this relationship of physician superiority to the patient doesn't really exist in Chinese medicine because we're both we're both walking down that path together. We're both cultivating and unfolding the journey ahead as fellow humans. And so I always feel like that's a really nice cooperative sort of attitude.
Well, you mentioned herbs, and the next question from Airy Ozone was, do you give patients herbs along with their acupuncture treatments?
Yes, very often, very often. Working at the Institute for Health and Healing is often challenging because the patients that get sent to me are often, they're the most difficult cases that have not been well addressed by their specialist providers, and they're on multiple medications, sometimes a dozen medications or more. And so introducing Chinese herbal medicine into the mix may not necessarily kind of bring the body clarity that we're looking for. And also there's the risk of interaction. So we got to be, pretty careful with that. But I'm really delighted that due to the hard work of many people supporting me, I've been able to prescribe herbs at Sutter, which is almost unheard of in the conventional medicine setting, right? Because of liability concerns and whatnot. But yeah, I often prescribe herbs, and I'm an herbalist at heart. I mean, that's what brought me into Chinese medicine in my late teens and early 20s. And I have a real love affair with the plant medicine.
That's wonderful. Next question from Maryland. Does acupuncture help with bone on bone knee?
Mm. Yeah, I mean, it's not going to magically regrow any cartilage, unfortunately. But I'm often surprised by the results that I get. It's on a regular basis that I'll look at somebody's MRI, for example, of their lumbar spine, and there's just such derangement going on in there. I don't even know how they're walking, but they're here for shoulder pain. And I ask them, how's your how's your back? And they're like, oh, it's fine. I don't have any pain. Other times they have exquisite pain. And I tell them right up front, I don't know that we're going to be able to make a difference because the structure is just so bad. We're up against a lot, but we'll give it a try anyways. And those are the cases that surprise me the most because oftentimes they come back and they say, it's like 40% better, 50% better, and they get better and better and better. So structure does not necessarily become your destiny for pain and suffering, right? Now, bone on bone is a difficult situation because you've got mechanical wear and tear that's going on there. And so there's always going to be inflammation and nerve irritation. But what we can do is we can help to prevent the brain from rewiring so that you're constantly in pain all the time. So there's lots we can do to help with that.
Wonderful. Would acupuncture affect heart rate or rhythm for those with AFib? Asks Linda.
Yes, it certainly can. And depending on the severity of the condition and how long it's been in place. A lot of times heart conditions like that, they're electrical in nature. And that relates to the nervous system. And so as we start to relax the nervous system and improve the vagal tone, what we start seeing is that there's better heart rate variability and a more regular heart rate as well. In fact, regulating the heart in the lineage of acupuncture and Chinese medicine that I practice, regulating the heart is of the utmost importance and often takes priority in the treatment plan. Like we got to stabilize the heart first before we can do anything else. The heart is like the emperor in the kingdom, right? And if the emperor's gone, everything else is going to be in chaos, or he'll just be dead. So, so very important. And yeah, I definitely think that there's lots we can do there. And I wish people would get acupuncture first before starting medication. Now, they should consult with their cardiologist first, right? I think that that's appropriate. But if it's not life-threatening, maybe give acupuncture and Chinese medicine a try. And if it doesn't respond, then we've got the medication that we can resort to if we need to.
Absolutely. So Mike says, is it always one-time needle use? I always see you throwing them away, so I think that's true.
You don't see me licking it and then putting in the next.
Yeah, or you or reusing them. No sharing needles, etc. for
Yeah,
sure.
no, historically, reusable needles were the norm because, there was a scarcity of resources, right? So you had one good set of needles and you'd sharpen them every day and boil them between patients and whatnot. That practice is long historical. In the United States, across the board, they are single-use sterile needles. They're always disposed of in a biohazard container and incinerated. So you're always getting a fresh needle. You should never be getting a reused needle. Now, if you go to China, that's a different story. They in their clinic sometimes they'll reuse needles, but they have much larger needles that they will autoclave in bulk, right? Because they're going through so many of them. Excuse me. And so that's one of the advantages that we have here in the States in the requirement of single-use needles is that we don't need a big thick implement that's going to withstand multiple boilings and autoclavings, right? And sharpenings. We can use a very, very fine implement. I mean, I can probably fit 4 or 5 of my everyday needles into the bore of a hypodermic syringe used for, a typical injection. Maybe 2 or 3 in like a typical diabetic syringe, right? If you're injecting insulin. So they're very fine.
Yeah. Yeah, they are. I mean, the needle doesn't hurt, but sometimes when you hit a point, it'll be like, oh, like that hit a nerve or
Right.
whatever.
We want to stimulate the point so you get a unique sensation. They call it Dutchie, and that means that the point has been activated. And yeah, it's a unique sensation. And
Yeah.
it's not horribly uncomfortable, right? It may make
No, no, no. It's
ooh,
just it's like it's just you got my attention with that one. No,
yeah,
yeah, it's
right.
not
Get your
pain.
attention exactly. And it
Laura
goes
says
away. So,
Laura wants to know if it can help with sciatica.
oh yeah, sciatica is like, that's my bread and butter game right there. In fact, chronic low back pain and sciatica are probably the most common referral that I receive. That and chronic neck pain. So Medicare covers acupuncture for chronic lumbar pain only. So the research evidence is sufficiently strong that Medicare has recognized it as being reimbursable for chronic low back pain. So yeah, sciatica responds really well to acupuncture.
Yep, absolutely. But Kathy says, what about for a frozen shoulder? I did 7 sessions in acupuncture and it didn't help. Any suggestions?
Yeah, frozen shoulder can be difficult sometimes, depending on what else is going on in the body. My personal approach I take to frozen shoulder will be acupuncture, heat therapy. We'll do pneumatic cupping on the shoulder, and also I give herbs because that's often a particular imbalance in Chinese medicine where the connective tissue is not being nourished enough by the blood and it's drying out, and so it gets inflamed and then it starts to bind, right? It gets kind of overgrown, and that's the frozen shoulder. And so we got to address that underlying imbalance. Because what you'll often see is if somebody's got frozen shoulder, they often have other tendinopathies like plantar fasciitis or Achilles tendonitis, tennis elbow, things like that. And it's all pointing to this underlying current in the ecology of their body that needs to be addressed. So it may be that that particular practitioner um, didn't pull in enough of those other modalities. Other cases are particularly challenging and recalcitrant to treatment. So, but also 7 treatments, I think that's kind of just scratching the surface for frozen shoulder. Frozen shoulder usually takes 6 months to a year to completely resolve, in my experience.
Wow, thank you. Pretty Girl's mom would like to know if acupuncture can be helpful for someone who is bipolar with anxiety.
Mm, that's a great question. Yeah, absolutely. Absolutely. I've had many patients that have bipolar disorder, and they've tolerated the treatment very well. And it's often helped with their anxiety quite a bit. I think one of the things is that as part of the treatment, we're sitting and getting calm together. And so there's like this supportive emotional state that's taking place there. And I think for some folks that's good medicine in and of itself. So mileage may vary on that depending on the severity of the condition. But again, I feel like it's always worth taking a stab at it.
Yeah, no pun intended, or pun
I think,
intended.
yeah, funny opinion.
Well, speaking of that, video of 1,000 Nights is sending you a joke. Why can't you trust acupuncturists? Because they'll always stab you in the back. Ha ha ha.
Ugh.
All right, but he does have a question.
Now
He
they're
says,
needling me. Okay.
yep. He has a question. Are the feet charts that correspond to each part of the body or organ in the body real, or is it something else?
Oh yeah, that's a great question. So this is an interesting thing. I mean, we see this occurring throughout the body, and it's what we might refer to as a sensory motor homunculus. So it's like a holographic representation of the human body that's superimposed over, say, the palm of the hand or the sole of the foot. And this occurs like elsewhere throughout the body, the stomach, the ear. For example, we can treat the whole body needling the ear. The whole body is represented there. And it's like an upside down fetus. The head is here. This would be the spine, and the feet are kind of down here. Internal organs are in here. And so, yeah, I definitely think that there's something to it. We don't needle the soles of the feet, thankfully, very often. Wouldn't have very many repeat visitors for that. Uh, but yeah, that's like foot reflexology is what that audience member is most likely referring to. And I would say it's part of the whole sort of structure of acupuncture, but it's not formally included in acupuncture necessarily.
Yeah. Did you ever hear that joke? I went to the acupuncturist the other day. When I got home, my voodoo doll was dead.
Always with the sharp humor, AJ.
But I'll be here
Actually, I
all.
thought that would be a good one for like remote acupuncture, right? Like
Yeah.
a voodoo doll
Yeah.
and
Oh, that's fantastic. TS would like to know, is acupuncture and acupressure used in the same manner to help with different things, and is it regulated in the same way?
Oh, great question. To the best of my knowledge, acupressure is not regulated in the same way as acupuncture. I mean, acupuncture Yeah, it's basically an invasive procedure, right? We're performing a minor surgical procedure, if you will. And so that, of course, has to be regulated very strictly, whereas acupressure is more on the spectrum of like shiatsu type massage, right? Where we're applying pressure externally, but we're not penetrating the flesh. So there's much less chance for deep tissue injury or disease or infection, things like that, right? Pneumothorax or, you know, bleeding or anything like that. So it tends to not be regulated in the same way. Its application, I would say, is roughly in line with acupuncture principles. I mean, we would probably choose the same points to stimulate. Let's say somebody's got GI problems, we would probably stimulate the same point that's just below the knee. I would do it with needles. The acupressure practitioner would do it with their finger or with a little tool, a little implement to provide pressure there. So yeah, a lot of overlap there for sure. And I think for the most part, acupressure is taken from the principles of Chinese medicine and acupuncture practice.
Nice. Thank you. This is from Mimi. Have you had success treating Lyme disease with acupuncture?
Oh, yeah, that's a good one. Honestly, Lyme is really challenging to treat with just acupuncture. It can help a lot with the aches and pains and the fatigue and the brain fog. But sort of that recurrent illness that kind of comes up, that viral malaise that comes up with Lyme, we definitely would want to pull in botanical medicine for that. There's a lot of great herbal formulas that we can use. And I've had good success treating Lyme disease with the herbal medicine.
Cool. Thanks. And this is from Vital Energy Wellness. How about rheumatoid arthritis?
Mm. Yeah, rheumatoid arthritis is also treated by acupuncture. You know, again, with something like rheumatoid arthritis, we're looking at sort of an autoimmune condition, right? Where the body is misbehaving, its immune system is misbehaving. And so it's more than just treating the pain itself, right? You got arthritic hands. It's more than just needling the hands, right? We got to figure out what's happening in this individual's body ecology that's leading to this happening, right? I mean, and this is the at the core of my practice is figuring out what's going on in the body that's leading to the arising of these other symptoms. You got chronic back pain. Why? You know, what else is going on? So that's why we got to do a real thorough evaluation. And so for rheumatoid arthritis, there's a lot of other things we want to pull in as well, especially attention to diet and lifestyle. These are very important things because, of course, diet has a profound effect on your immune system and inflammation. And so when you're working with a hyperinflammatory condition like that, you're going to really want to follow a strict anti-inflammatory diet.
Well, here's the thing, you know, we get a lot of doctors on this show, and people will say, well, will the plant-based diet help me with this disease, and this disease? And the thing is same thing with acupuncture, even if it doesn't help your condition, it just helps balance you overall. That I think it's still worth it, even if it doesn't exactly cure your particular disease. At least that's been my experience as somebody with anxiety. I mean, it's just I just go right into that deep restorative state. You know, I'd have it every day if I could.
I know you would. I'd be
Absolutely.
your personal attendant, right?
Absolutely. And while I'm on the table, you could teach me how to play Settlers of Catan because
There
I
we go.
play a lot of games. We have monthly game parties here, and that's one game I
Although
have.
you mentioned that you like to play poker.
Oh, I haven't played poker since I moved out of LA. There's just nobody
You
to
were
play
saying you
with.
couldn't find anybody to play cards with. Yeah.
I cannot find anybody
We're
to play.
running into the same problem. Maybe we should get a game.
What I play poker with you. You get ha 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 ha. Okay, my gosh, I had no idea that this topic would be so interesting to my audience because I keep getting questions after questions. So, Cherry would like to know, is insomnia a diagnosis covered by insurance as well as anxiety or depression? Because you had mentioned for Medicare, you have
Mm.
to have, and here's the thing, maybe you can get me in after March 1st because I have had chronic back pain. Maybe there's a
Yeah, that's
loophole.
something we can definitely talk about. Yeah.
I don't want to let you go because I had so much
I,
fun.
yeah,
Fun.
I mean, I don't want to lose you as a patient either. So,
Oh my
um,
gosh.
yeah, great
But that's a good
question.
point because I think isn't it if it's ordered by a doctor, like I mean, I think it always depends on a person's insurance, I would imagine.
It does. Yeah, it totally does. Everybody's insurance plan is a little different. Some plans require a physician referral, and others you can self-refer. Like my coverage, I don't need a doctor's referral. I can just go for acupuncture, and if they're within network, my benefits will cover it for up to 20 visits a year. Um, so you'd need to confirm your benefits first, whether you have acupuncture coverage, and then from plan to plan, there's also a difference in the diagnosis that are reimbursable, if you will. And so the ones that are almost always reimbursable are going to be chronic pain conditions, especially neck and low back, chronic knee pain, and then nausea and vomiting, especially related to either pregnancy or chemotherapy. Those are almost always reimbursable. Insomnia is kind of questionable. Sometimes they will, sometimes they won't. So the best thing to do is to call your insurer and find out, what are the limits of diagnosis codes for acupuncture? I'd like to go get it for insomnia. Is that covered? Or, and if not, well, do you cover it for anxiety and depression? Anxiety and depression are typically not reimbursed by insurance companies for acupuncture. So, but if you got low back pain, you can come treat the low back pain, and maybe in the process, we'll be able to address the other things that are going on as well, because we're attending to the whole person, right? It's about whole person wellness, not just poking the low back to make it feel better. We got to make sure the rest of the person is feeling good to support the healing of the low back pain.
Absolutely, absolutely. CN says, do you use DMSO, dimethyl sulfoxide, with herbal treatment?
I do not. We usually use, if we're going to do like an herbal liniment or something like that, it's usually alcohol based or some sort of a neutral oil base. Yeah, I've not explored the use of DMSO for doing herbal extractions or anything like that. I would assume that's referring to topical
What
use.
do you think of ginseng?
I mean, ginseng's one of like the queen herb in the apothecary. Ginseng's amazing stuff, and it depends on what kind of ginseng we're talking about. I mean, there's the two major classifications. There's Panax ginseng, which is what you get from China or Korea, which has a very warming sort of a quality. It's a fabulous tonic. I mean, it treats the body's innermost repository of energy and vitality. And then there's American ginseng, which is more cool or cold in nature. And so that's very good for clearing heat in the body, which when I say heat, we might refer to that as inflammation in conventional medicine view. And so there are some that say, uh, that the American ginseng is actually most ideally suited for the American diet and lifestyle, because most Americans who follow the SAD diet, the standard American diet, tend to be hyperinflamed. And so the American ginseng kind of quells that inflammation. However, for folks who are low on inflammation, like the vegan audience, I would assume, is probably running pretty cool as far as inflammation is concerned. They would probably tolerate the Chinese Panax ginseng much better, and that would probably be more appropriate. It would be warming to kind of offset the sort of cooler nature of the plant-based diet.
Nice. Thank you. What about ALS? Leanne wants to know, any improvement for motor neuron disease?
Mm. Well, anytime you're working with the nervous system, there is a chance that there's going to be an improvement. Unfortunately, I have not had any ALS cases to date, so I can't really speak personally on that, and I've not delved deeply into the research literature on that particular condition either. So unfortunately, I'm not really in a place that I can offer an educated opinion on that. But it's certainly worth looking into, you know.
Yeah. Can it help with weight loss?
Yeah, that's a complicated one.
Yeah,
Yes,
you know what you do is you just take a needle and you just kind of sew the lips closed. Yeah.
I'm going to keep stabbing you until you put that cookie down. Yeah, the short answer is yes. However, it's kind of a nuanced conversation, right? Because again, we got to figure out, well, what's going on? Why is somebody having a hard time losing weight, right? Same thing with smoking cessation. It's more than just the nicotine addiction, right? I mean, we can do acupuncture to help to curb the cravings and relax the nervous system so you're not jonesing for a cigarette. But if you live in a household where everybody smokes socially, there's a big social component, right? And there's going to be a lot of discomfort that you're sitting in the circle and you're the only guy who's not smoking. And so same thing goes with diet um, and weight loss. We got to figure out, well, what's underlying? Is it hormonal? Is your thyroid low? Is it stress that's leading to elevated cortisol and causing an accumulation of body fat that won't go away? Is it stress eating? Are you eating the wrong kinds of foods maybe that don't really agree with your body? Right? So Chinese medicine is great in this way that we're looking at the uniqueness of the individual and figuring out what they need, right? It's not just dogmatic and say, well, everybody's got to do this particular approach because it's good for you. Well, it may be good for some folks, but other people may need something different. And so some folks need to warm up their diet to lose weight, right? Eating more salads may not get them to where they're going, or having smoothies. Sounds great on paper, but maybe what they need to do is actually stoke their fire. And so have more things like curries, more things with warming aromatic spices and things like that. So, so acupuncture can help with weight loss, yes, and it can do it through some genetic expression as well. There's some research out there that shows that regular acupuncture of the abdomen actually causes changes in gene expression in the body that help to promote weight loss. So give it a shot. I mean, it won't hurt that much, right? Excuse me.
Well, I've got one more question for you, Mark. What message of hope would you share with someone currently facing a cancer diagnosis?
Mm. You know, that's an interesting question. Sometimes when we are faced with these situations, it brings into our awareness the preciousness of our life, our loved ones, and those connections. And I think that the beautiful part of it is that it's an awakening for many people. All of a sudden, we become very aware of our body and what our body is asking for. We become aware of our health, our lifestyle, and the treasure of life, right? So many of us forget that it is the greatest gift is to be alive. So I think that that's like the silver lining in that. And so stay focused on that part, the sweet connections that you have with your loved ones and their friends, even a stranger passing on the street that may look at you and you smile at them and their scowl turns to a smile. These are all nourishing moments in life, right? So follow that thread and walk the path lightly.
All right. Well, thank you so much for your passion and compassion and all the wisdom that you've imparted. And I just really appreciate having you in my life.
Thank you, AJ, and you. It's been such a pleasure to be on your show today. I'm deeply honored to be able to represent my
And
profession.
you may not know this because we haven't talked about this in a while because I haven't had new guests. I've been doing the same guests that were on before. Every first-time guest on Chef AJ Live gets 2 free bottles of California balsamic vinegar, courtesy of Tommy Balsamic.
Sweet.
Yeah,
I'll
so
look forward to that.
you did the show even before you knew about the free.
Yeah, right. You didn't have to persuade me too hard.
Absolutely. Thanks so much, Mark.
Thank you, AJ, and thank you to your audience for
Uh,
today.
I
Much,
will see you
much
soon.
appreciated.
I will see you soon for our appointment. And thanks all of you for watching day 5 of Thriving in the Face of Cancer. I want you to know that wherever you are in your cancer journey, as long as you're still breathing, there is hope. So please come back tomorrow and know that you can too thrive in the face of cancer with our special guest at 10 a.m. Pacific time, a legend, the father of lifestyle medicine.